Good morning, ladies and gentlemen. We might start today's proceedings if that's all right. Welcome to the second day of the 2015 Connecting Asthma Care Conference. I'm delighted that we're able to see so many individuals who've returned for the second day after the final session yesterday. If you missed the final session, ask your colleagues. On behalf of Asthma Australia, we'd again like to acknowledge the traditional owners of the land, the Turrbal people, and thank them for their custodianship on the land on which we meet today. And for those of you that don't know me, my name is Mark Brook and I'm the Chief Executive Officer of Asthma Australia, and I'm very proud to lead a wonderful organisation of very hard-working staff across our very small National Secretariat. Today is World Asthma Day, so congratulations to all of you for being here for this important event, and I'm particularly delighted to welcome Professor Ines Asher, the Chair of the Global Asthma Network, who is with us today, and we're delighted that you can be with us, and we look forward to hearing from you a little bit more about your perspectives on global asthma. My colleague, Dr. Peter Anderson, the Queensland CEO, will get up and give you some quick housekeeping tips for after Ines has spoken, but really today is about building on the platform that was laid yesterday. Mark Levy's speech has created quite a bit of conversations within our own community about who's to blame was a question I was asked at a media interview this morning. I said, really no one. I said, I think part of the problem is we tend to ascribe blame before looking for solutions. And one of the things that we're particularly interested in and focusing in the conference is what are the solutions that should be developed over the next 5 years as part of a new national asthma strategy that's currently being developed. And we encourage you to join in that conversation by making submissions and certainly talking to our colleagues and friends at the National Asthma Council of Australia and our team at Asthma Australia so that we can hear from you about what are those driving priorities. So without further ado, ladies and gentlemen, I'd like to welcome Professor Asher up to the stage to welcome you to World Asthma Day 2015. Thank you.
Tēnā koutou katoa, kia koutou te mana o tēnei whenua, tēnā koutou, tēnā koutou, tēnā koutou katoa. I tau mai ana tātou ki runga i te karanga o tēnei wā, o tēnei rā. Ko te rā o te mate i huangau, he kaupapa nui tēnei ki a tātou katoa. Nō reira, he honore nui a hou, ka tua hou, ki mua i a koutou i tēnei wāhi i tēnei wā. Greetings to you all, greetings to the original people of this land. It's a great day today that we're all here for this occasion for World Asthma Day, and I feel very honoured to be speaking here in front of you today. Happy World Asthma Day. So World Asthma Day is an annual event organised by the Global Initiative for Asthma, GINA, since 1998 to improve asthma awareness and care around the world. And the theme of today is you can control your asthma, and a sub-theme is it's time to control asthma. I think that's been manifest throughout this conference that these are the themes, and we're doing a lot about them. And there is more to be done. Because asthma is seriously neglected at the world scale. This is because other diseases are more fashionable, like diabetes or obesity. Asthma is relatively invisible compared with obesity, stroke, cancer, and so on. And there are big gaps in asthma data. There's been no new prevalence data on asthma in the world since 2003, 12 years ago. There is no WHO monitoring program on asthma, and at the present time there's nobody in WHO who has any expertise on chronic respiratory disease, let alone asthma. But that is going to change, I understand. Asthma is one of the commonest global respiratory diseases. This shows tuberculosis, rare but very uncommon but very important. Asthma to pneumonia and COPD. Now, this estimate of 334 million came from the Global Burden of Disease survey, published in 2012 in The Lancet. When the next Global Burden of Disease survey is done, there'll be no change to this unless we have new asthma data collected. We'll be working on old data. So it's important that we keep up and monitor this disease as well as we monitor many of the other common diseases. Asthma causes disability. It's the 14th most important disorder in terms of global years lived with a disability. Again, this data is from the Global Burden of Disease project. If we look at asthma disability adjusted life years, or DALYs, which are defined as the years of life lived with a disability plus years of life prematurely lost, we'll see that DALYs occur at all ages from the beginning of life to the end of it, DALYs from asthma. But particularly, the disability is more common in mid-childhood and in the older people. Economies suffer because of asthma. Children miss work, adults can't work. Many adults don't work effectively, and work by Mark Fitzgerald and his colleagues published in Chest recently showed that actually there's more loss of productivity from people with asthma not feeling well being at work than there is from taking time off work. Asthma costs are huge, as indicated here, and our latest New Zealand estimate is $800 million, and that was for medicated asthma, which probably doesn't capture all the people with asthma. Hundreds of people in the world die from asthma every day. Hundreds. This shows data from WHO mortality showing how the top group is the high-income countries, the bottom group low and middle-income countries, and showing how some of those low and middle-income countries, the death rates are extremely high, the highest being South Africa. But deaths do occur in high-income countries, as we know, as discussed yesterday, and they are most common in our countries. Australia, the United Kingdom, USA and New Zealand are the worst four for high-income countries. That's pretty scary. But the fact that asthma deaths are rare lessens the visibility of asthma. If we look again at the Global Burden of Disease data, we'll see that asthma deaths rank at 34th cause of death. But that's still about 400,000 people dying each year from asthma in the world. It's tenfold higher for the other most common diseases that top the list, but it's still a huge number of people dying from asthma, and I think that people have forgotten that that's occurring. And we need to make the morbidity from asthma is just as important as the mortality from asthma, and we need to have attention to both. In fact, it was very pleasing to see Ban Ki-moon, the United Nations Secretary General, opening the United Nations NCD review meeting last year, who actually said in his opening speech, the global epidemic of NCDs is a major and growing challenge to development. Each year in developing countries alone, strokes, heart attacks, cancer, diabetes, or asthma, my bold, kill more than 12 million people between the ages of 30 and 70. Low and middle income countries are where most of the people live. That's the red, orange and yellow countries shown here, most of the world. And they are particularly disadvantaged when it comes to asthma. And only 28% of 52 low and middle income countries surveyed, only 28% had both inhaled corticosteroids and salbutamol on the essential medicines list. Only 28% thought they were important in those countries. And the costs can be unaffordable as well. And this is a survey done, published in 2013 for beclomethasone, showing how it compares to the days of minimum wage to buy one. And you'll see here in Madagascar, it was 2 weeks minimum wage before you could afford to buy an inhaled corticosteroid. That was the cost of it. So the brown ones are the generic products and the blue ones the innovator products. And although many of the other countries had a smaller amount of cost, it's still huge compared to the relative costs for places like New Zealand and Australia. Huge costs. And the Global Asthma Network did a survey on national asthma strategies, how widely they were present in countries, and only about a quarter of the countries had national asthma strategies. We'll be hearing a lot more about that in the next presentation. So that's the blue bit of the pie. The rest of them didn't have them, and some didn't know. But you'll see that national asthma strategies were more common in high-income countries and less common in low and middle-income countries. So that's a whole piece of work we can be doing. This can all be changed. The Global Asthma Report, which Global Asthma Network produced at the end of last year, has summarised 16 recommendations to governments, WHO, health authorities and health professionals. And we believe that the serious neglect of asthma can be changed by raising awareness of asthma, its burden and effective management, and also particularly raising awareness of deaths, that's been highlighted. National asthma strategies, quality assured essential asthma medicines available and affordable for all who need them, more data and monitoring, higher on national and global priorities, and political commitment. And I've heard at this conference how that's been present in in Australia since 1991, and it certainly isn't present in New Zealand at the moment. We're working on that. So today is World Asthma Day, and last year GINA published the Global Strategy for Asthma Management and Prevention, and I'd like to congratulate Helen Riddell, I think, who led that project, who's speaking later, and to acknowledge Mark Levy, who's also on the executive of GINA. So we have these great leaders in our midst who've contributed such a lot to asthma and particularly to World Asthma Day. So World Asthma Day is organised by GINA in collaboration with healthcare groups and asthma educators to raise awareness about asthma and improve asthma care throughout the world. So that is us, and that is what we're doing right here, right now, yesterday, today, and for the rest of the year. Thank you very much.
When we were preparing for the conference and we noticed that Ines had very kindly registered, we thought, who better to recognise World Asthma Day on our behalf? So Ines, thank you very much. It's great to have someone of Ines's stature and knowledge about the position of asthma globally to talk to us today. I think sometimes we get very caught up in our own work. We know what's happening in our own neighbourhood. We understand what's happening in Australia maybe, but to see the position of asthma, I think globally is great. So thank you for your presentation, Ines.